Good afternoon. It's my pleasure to welcome you to today's really special environmental studies lecture series talk in honor of our late colleague, Jonathan Kenny. This music, as you can see, was composed by our colleague, John McDonald, who's here in the audience. Thank you very much, John, for your tribute to Jonathan. So the environmental lecture series is brought to you by a really generous gift by two Tufts alumni, siblings who endowed this series and make it possible for us to bring really outstanding weekly talks to you. Many of our talks are co-sponsored, and this week is no exception. The Department of Chemistry is co-sponsoring, Tisch College, and the Tufts Digital Collections and Archives. So thank you all for contributing to this special event. If you want to learn more about our talks, you can go online and learn about it. There will be a link in the chat for those of you who are online. And if you'd like to take a look at the fall roster, you can also learn more about upcoming talks. Just for those of you online, the chat is disabled. So if you have questions from today's speakers, please put them in the question answer. We'll be moderating those questions and we can present those. So we're here to celebrate the life and the work of Jonathan Kenny. Jonathan spent almost 40 years here at Tufts, and he made quite a lasting impact, both to the Department of Chemistry and to the Environmental Studies program, and to the environmental programs at large within the university. He was really committed to finding a balance between his scholarship, his teaching, and his commitment to environmental stewardship, to a cleaner, greener environment. I want to welcome all his family and friends who are here virtually online. Thank you for coming, and we hope that this can serve as a reminder of his impact on Tufts University, our students, and the program. We miss him dearly, and I want to share some of the things that Jonathan did while he was here at Tufts. So he came to Tufts in 1981 after a brief postdoc at Wesleyan University. Prior to that, he did his PhD at the University of Chicago in physical chemistry, and he also received a bachelor's in chemistry and with a concentration in mathematics from Notre Dame. In his nearly 40 years here at Tufts, he did quite a number of things that are just really quite amazing. And I'm going to highlight some of those things that specifically relate to the environment. As I kind of highlighted, he had these dual passions, understanding his work in the field of chemistry, training grad students and undergrads, but he had this other side of him that was really committed to the environment. And early on in his career, he developed the environmental chemistry class that many students have taken over the years. In his research, he looked for developing sensors that would help discover and map environmental contaminants. And he pioneered, as I understand it, within the Department of Chemistry on how they could do their teaching and their research in a greener, cleaner way, developing new ways of sort of teaching chemistry. He was also involved in a lot of faculty, university-wide committees. He was one of the early faculty advisors to the Tufts Institute of the Environment. He taught the Tufts Environmental Literacy Institute with our colleague Anna Rappaport, which motivated a class later called Telling the Climate Justice Story. And this was a class that was really adored by students. At the university level, he was also on the Sustainability Council, really an important advisor to the administration on thinking about how Tufts could limit its environmental footprint, try to limit its impact. He was a staunch proponent of divestment, and he really understood the importance of interdisciplinary thinking and perspectives in terms of how do we tackle some of the grand environmental challenges facing society. You can't just do it as a chemist. You can't just do it as a policy person. We need people working together. And he really sort of looked for ways to bring disciplines together. I got the privilege of working with Jonathan for a little over 10 years when he joined the executive committee of the environmental studies program. And he always had really sage advice. He worked tirelessly to help us grow the program, volunteered his time in all sorts of different ways. We really are a better program for his efforts. Because of his interest in pollution and a cleaner environment, he would often interact with today's guest speaker, and so would have him come to class and talk about his work. So Stephen Lester is, I'm really pleased that you could come and participate in today's lecture and present to us some of the work that you've done. You are no stranger to Tufts. You've been back numerous times interacting with faculty in the program, outside the program. And it's just really fitting, given you're interested in environmental contaminants, especially as it relates to chemistry, and Jonathan's interested in a cleaner environment with less pollution. So Stephen is the science director at the Center for Health, Environment, and Justice. And he's dedicated his life to train individuals and communities to sort of help stand up against sort of organizations, industries that are polluting the environment, and to make them pay for whatever pollution. And he and his wife, Lois Gibbs, began their fight after the Love Canal travesty in the late 70s, early 80s, and recognizing that someone has to be accountable, someone has to sort of make sure to figure out how to get things fixed that have gone seriously wrong. And that is also a truly interdisciplinary endeavor. We need to know the science, we need to know how to bring people together. He has a master's degree in toxicology from the Harvard University School of Public Health, and he did his biology degree as an undergrad at American University. No doubt some of the students in this audience or online have kind of explored the work of the CHEJ. We are fortunate to be the repository of their records. And so students have gone into the digital archives and they've collected and analyzed and sort of looked for insights that come out from their work. And Stephen, welcome back to Tufts, and thank you for being here.
Thank you, Colin. Can everybody hear me okay? Is the sound working all right? Great. I'd like to say just a couple of words about Jonathan Kenny. As Colin mentioned that, I did get to meet him. We were very fortunate when we made the decision to donate our documents here, that the lady who ran the library at that time, the digital element of the library, was really very excited about it. And she helped introduce me to a variety of faculty, including Colin. And so Jonathan was one of those people. And what struck me the most about Jonathan was not only his passion for chemistry, but his passion for helping and teaching his students to think outside the box. I've done lectures in universities, mostly with environmental studies programs, but it's rare that somebody from a core science like chemistry will invite someone like myself to, because I'm not going to speak about chemistry and the wonders of chemistry. I'm going to talk about kind of a different side of chemistry. And so he was very excited about me talking. And I remember one time he didn't want me to just give a simple lecture about what I do or our work. He really wanted me to challenge the students. So I said, well, all right. We have trainings we do with our community people in which we actually put them in a role plays in which they are community people or they're government people or they're the polluters, and we give people different roles to play. And he said, that would be perfect. And so we did that. And we broke his students out into different groups, and they had to think about, okay, where are we going to put this testing? That was the question on the table. Was, all right, we have to install some new testings, and what are you going to test for, and where are you going to put those tests and why? And so, I mean, he was very excited about that kind of opportunity for his students to think outside the box, think about the application of chemistry. And I give him a lot of credit for wanting to do that. And he was very different than many other professors that I've met over the years. So it's really an honor and a privilege to be invited here, to be connected to this series and to Jonathan. So I'm really happy to be here. All right, so now let me talk a little about what our work at CHJ. CHJ was founded in 1981. We came out of the Love Canal crisis that Colin referred to briefly. I'm going to talk a little more about that. But what we do primarily is provide organizing and technical assistance to grassroots community-based groups around the country. And we've done that for 40 years. And this year is our 40th anniversary. We have some buttons. I've left a few here. If people want to take a few, take one, those of you in the audience here. But we're celebrating 40 years because as a nonprofit, I mean, it's pretty amazing that we've been here for 40 years. When Lois and I first started the organization, there's no way we thought we'd be doing this for this long. We had no idea what was going to happen, honestly, but certainly not being here for 40 years later. And I'll mention a little bit at the end, a little more about our digital archives and the documents that are here, but that's also an important part of what we do. So let's see here. Let me see, how do I get this working? Here we go. So my role at the Center for Health, Environment, and Justice as the science director is to do essentially two things. One is to deal with the science, all the science, whether it's engineering reports, health studies, environmental test results, and to share and to help people understand what all that means. To write reports, I do what I refer to as letter reports all the time, in which I will review a document, help people, and interpret it for people. I tell them two things, tell them what it says, but very much equally important is tell them what it doesn't say. And the second half of my work is to help people understand how the science fits into their organizing work or their campaign work or their work on the ground dealing with whatever the problem is. I mean, when we first started out, and this is true of so many people, most people believe that if you just put the right information in the hands of the right people, the decision makers, they're going to do the right thing. Only in the real world, that does not happen. And there's all kinds of reasons why it doesn't happen. But that's part of what I help people understand is where the science fits in. And I'm going to talk about that. I'll give you some specific examples in our work of how groups took the science and did something with it. One of the things we often do in our trainings is we ask, we kind of break people into science tracks and organizing tracks, and they can focus on one or the other kind of during these trainings. And one question we often ask is information power? And we ask them, raise your hand, yes or no, and most people say, oh yeah, of course, information is power. And it's not the way we see it. Information is critical, information is important, you can't win without it. But if you don't have a plan for how you're going to use it, then science and information doesn't really work for people. So it's not about having it, it's about having a plan for what you're going to do with it. That's critical. So let's see here. So these are the case studies I'm going to talk about. These are the places: Love Canal in Niagara Falls, New York, Bridgeton, Wausau. I noticed today that the paper you have in your restrooms all comes from Wausau, Wisconsin, and not far probably from this contaminated site we've been working on. Yes, Love Canal is the first one. Many of you know Love Canal, know the story of Love Canal? Okay, fair amount. That's great. That's good. Briefly, just how Love Canal came about was a developer who had a great idea to build a model home, a model city between the along the upper in Niagara Falls, between the upper and the lower Niagara rivers. And he started building a canal that would connect the two rivers, about a 10-mile stretch. And what happened is, this was at the turn of the century, and they discovered alternating current and realized that you didn't have to have homes so close to the source of energy. So that project got abandoned. What was left was a canal, a partial canal. And somewhere into the 40s, Hooker Chemical Company, there are many chemical companies in Niagara Falls area, but they purchased this land, this canal, and they started dumping toxic chemicals, their waste products, into this land, into this canal. They would cut off a piece of the water, they would drain it, and then backfill it with chemicals. And they eventually put 20,000 tons of toxic chemicals in there. And then in the 50s, they sold it first to the school board, the Board of Education of Niagara County, and then they built a school on top of the landfill. And then shortly thereafter, once the school was there, individual private homes were built that backed up to the canal. And that's what you see here in this picture. These are the homes that back onto the canal from the left and the right, and in the center is the actual old landfill. And so when Love Canal became a national issue in 1978, when they evacuated the first rows of people who lived around this, levels of chemicals in the homes that were just evaporating out of the ground were exceeding occupational standards. And that's just enormous, because most people in these communities are exposed to thousands of times less than that. And so these people were exposed to enormous levels. And what ended up, I got a few more pictures here of Love Canal. That's just another picture, aerial view of the landfill in the center and the homes on the back. You can see some circular, those are swimming pools, above ground swimming pools. Nobody could put anything underground here because the ground was so soft and full of chemicals. I mean, a lot of these chemicals, a lot of the chemicals moved not only laterally away and into homes adjacent, but they moved through the storm sewer system. And they got into the lines of the systems that crossed the landfill. There were a number of streets that crossed it, and it got into the stones around the pipes and moved that way. And so people who had sump pumps, which was almost everybody who lived there, would have the chemicals evaporate through the pipe system up into their homes. So I mean, it was just people were getting it every which way. But it was just a crazy situation there. And what Lois did, she was the community person who organized the people here and started the Love Canal Homeowners Association. And I came and got into the picture when I was hired by the state of New York. I was working for a consultant in Washington, D.C. at the time, and I was hired to come in and be a technical advisor to the residents. Because after the first evacuation, there were 240 homes evacuated, mostly those homes you can see closest to the canal, but there was a surrounding neighborhood that was not evacuated initially. And so they organized that homeowners association, and they had a list of things they wanted. The very first thing is, we want relocation. They felt that they were also sick and hurt and vulnerable and being exposed to chemicals, but the state health department in New York said, no, you're fine. And constructed a chain link fence around the landfill and said everybody outside that is safe. So that fence clearly became a symbol of the government and the problem with the government. So let's see here. This is just another picture of the neighborhood. It was a very working class neighborhood. Ironically, in some ways, many of the people who lived here worked in the chemical industry, because that's the primary employer in the neighborhood. And so initially, Lois's strategy was to go door to door, collect information on health problems outside that chain link fence. And she felt that if she took that information to the health department, they would see that there's just as many problems outside as there were inside the fence. And what she discovered is that was not the case. I don't know if it was good fortune or not, but it was certainly educated me enormously, is to be with another scientist, Bev Pagan, who was working with the residents, to take the results of that survey to the health department and present to them those results. And we met with, from everybody, toxicologists, epidemiologists, scientists for all levels at the health department. And we had a good meeting, we thought. We had they listened to what we had to say. They were taking us seriously. They planned to follow with what we said. And when Bev and I took the airplane back from Albany back to Buffalo, where we worked out of, that's the closest airport to Niagara Falls, at that time, they had papers not only in the morning, but in the evening. And the front page headlines that we saw at the airport when we arrived was the words in 3-inch block letters, useless housewife data. And so for us, that was told us, and that's what they said about everything we had presented to them. So it was clear to me at that point that as scientists, we had one perspective, but there was somebody else who was dominating the narrative of what was being done and what was being said and how the state was going to respond to not only us, but to the community. So that was just for me the first of my many lessons of how science gets used and utilized in these situations. So at any rate, Lois realized at that time that just giving the people at the health department more science information wasn't enough. It wasn't going to move the state health department. They already knew that there were problems in the community, but they just couldn't politically acknowledge those. Because if they did, then they would have to do something about it. And they didn't have the resources. And this was a very crazy situation, but it's true in communities all over the country. Nobody has the resources to deal with these problems, so they don't want to acknowledge that they're real. And that's one of the biggest struggles people face. So Lois changed strategy, and her strategy was, okay, we have to bring more people into this fight. It can't be about what we as community people feel is wrong. We have to bring more people in. So they started to use the media more, they started to use signs, they had parades, they did things that would get them into the public eye. This down here in the lower left here is a full-page ad they put in the Niagara Gazette that talked about all the things that they can't do. It was in reaction to a hooker chemical ad that was also in the Niagara Gazette that said all the things that were wrong with Love Canal. And this was their version. So they did that. They had protests. They put signs up everywhere, but they made themselves very visible. And they involved their kids in a lot of the activities there. And this is just a Mother's Day rally, actually. And they were always well attended. They always had lots of people participating, and they had meetings. I mean, I've never since, never till that point in my life, and never since have been experienced anything like the meetings at Love Canal. 500 people stacked in an auditorium, people crying, people screaming, people upset. The emotions were raw as you can imagine. And it was very, very intense. But nothing changed until Lois recognized that the science by itself wasn't going to work. So she started to engage other people. They went to every association you could think of, from garden clubs to Lions clubs to all around Niagara Falls in the Buffalo area. And they said one thing, they said the New York State Health Department, they found 56% of the children outside the evacuated area were born with birth defects in a 2-year period. And they said the health department won't follow up with this. What's wrong with that? We need you to push the health department to do that. So suddenly all these organizations started calling the health department and saying, why aren't you doing this? Why aren't you doing this? And they got a lot of media attention. They got the word out to different groups around the state and the region area. And they eventually went to Washington and got more people involved. So all that pressure on the health department finally got the health department to say, okay, we'll do our own assessment of the reproductive outcomes in Love Canal. And they found the same thing the residents did when the health department came in. And so that created, it was in February of 1979 that the health department acknowledged this. And they said, women and children, pregnant women and families with children under the age of 2 should not be living in this area. So they said they can leave. And so that, of course, was on the one hand good news. On the other hand, it was terrible news, because like, what happens if you have 3 kids and only one of them's under 2? What happens to the rest of the kids? Can everybody go? I mean, there were so many questions. But that was the dam that broke the camel's back, if you will, or the straw that broke the camel's back, because that started the evacuation, and eventually the health department and the federal government came in and moved another 700 families because of the health risks that they faced. They did chromosome breaks and found 9 out of 11 people had chromosome breaks. They did sort of a lot of pilot studies where they gathered data, and eventually that was used by the government agencies to justify the decisions they made. But it was Lois's change in strategy from not just thinking that giving information is going to do it, but figuring out a strategy for using that. She used it to educate people. All these folks that she asked them to come to put pressure on and contact the state health department. It was the information that she gave them that educated them, and then had a plan for, okay, this is what we want you to do. And that was a very effective strategy. And it ended up, you know, they got a total of 900 families altogether evacuated from Love Canal. So this is another group we work with. They're called the Just Moms STL, and they're outside of St. Louis. And what they're dealing with there is a landfill that's been on fire for, I think it's 8 or 9 years now. I've kind of lost count. An underground fire that the best science that exists cannot figure out how to shut it off, how to put the fire out. I've got a picture here. It's it gives you a good idea. Whoops, I went the wrong way. This is just the moms at a protest. This is what happens when there are breaches in the cover of the landfill. And this might happen for 4 or 5 hours before they can cover it again and cover it up. People live in that neighborhood right across the street. There's a area called Spanish Village. And needless to say, these are people of color who are living right across the street from there, and they're dealing with this, not every day necessarily, but it got so bad that the school system for the kids who live in this area sent a note to the parents that said, you know, we have this ongoing problem with this landfill, and we need you to leave us any medication that your children might need, because they might have to shelter in place at the school, and we might have to keep them here. So this is how many of the people in the neighborhood who weren't involved in the landfill effort suddenly learned about this is a problem. And so they realized, oh my God, this is a serious problem. If this they might have to, excuse me, shelter in place. And so what I did with them is I reviewed a lot of the air testing that the state was doing that was looking at what's in these kind of accidents and what's general being monitored around the site. I also looked at the groundwater results. I wrote my letter reports. The group used that stuff or got that stuff, and they tried to figure out how to use it, but they weren't getting anywhere because they just took that directly to the state and said, here, this is what we have. What are you going to do about it? And then basically the health department said, well, we disagree. So they let it go. Nothing happened. So eventually they got the attention, well, right next to this is a garbage landfill, a regular everyday garbage landfill. It's called the Bridgeton landfill. And right next to it, owned by the same landfill operators, which are a company called Republic Services, they have a federal landfill, a Superfund site that contained radioactive waste from the Manhattan Project, because it turns out one of the main areas where they did research for this is just outside of St. Louis. And so the waste from that research went in this, what's called the West Lake landfill, which is immediately adjacent. They share the same land. And so this fire that was moving underground was moving towards this radioactive waste. And the state AG's office had a thermal expert look at this, and they made this announcement that said basically you could have a Chernobyl-like reaction, an explosion, if this fire reaches some of this landfill high-level radioactive waste. And so that, of course, elevated the situation to not just a local problem, but to a federal problem. And so the US EPA agreed to come in, even though they had already decided what they were going to do with this landfill. Now it was in the news in St. Louis every day. And so, so what we did is to get together with Just Moms and say, okay, you've got the US EPA coming in. What are you going to do? How are you going to present? How are you going to deal with this situation? And so they said, we really don't know. So we gave them some ideas. And we said, okay, you're going to testify, right? People are going to come and they all get their 3 minutes to testify. They said, yeah. She said, all right. So Lois said, all right, I'm going to come out a couple of days before the EPA does, and we're going to role play. You're going to have your people, whoever they are, come, and we're going to role play. And we created, and everybody got comfortable saying what they had to say, and everybody had the same ask at the end of their presentation. They could say whatever they wanted, but we asked them, and this was, this is what the group wanted. It wasn't something we came up with. They said, okay, we want to be evacuated. We want out. And so that was the ask at the end. We want out and we want this landfill cleaned up. And so when EPA came, the group did this, and it was an amazing experience because they were all right on cue. They all were very comfortable doing it. And that created huge pressure on EPA. They had never seen anything like that. EPA people were stunned. This was during the Trump administration. The Trump EPA is the one who came out and did this. And they made the decision to not evacuate people, at least not yet, but they made the decision to clean up the radioactive waste landfill. $253 million has been dedicated to the cleanup of that landfill. And so, so that's a huge win for the folks in St. Louis. And I hate to almost admit it that it happened during Trump, but it did. And this is the Citizens for a Clean Wausau in Wisconsin. This is one of my favorite stories because this group was the contamination in Wausau was caused by a window treating company. So they used chemicals that treat windows so that they won't rot. And so they use a chemical called pentachlorophenol, which was back in the day, was a very common material for treating wood and lumber. And so, but that generated, when it's burned or even when it's processed, it generates a contaminant called dioxin, which is one of the most toxic chemicals ever evaluated in this country. And so the neighborhood, the community that lives right next to the window plant got contaminated with dioxin from air emissions from the burning and the disposal of this, because they had not just processed the waste, but they tried to get rid of it by burning it. So that was making a bad situation worse. And so they got dioxin throughout the neighborhood, and they did some testing. Somebody got some testing done. They sent me the test result, and I thought it was pretty significant and suggested they do more testing. And so they didn't do that, but they sent the test results to the state of Wisconsin Health Department. And they have a toxicologist on the health department who did an evaluation of the public health risks. And so this was risks for dioxin, which is the most potent carcinogen ever tested. And he did this evaluation that just looked at the non-cancer risks of dioxin. And so it was like, really? This is the most potent carcinogen ever tested, and you're doing a public health risk assessment and you're not considering cancer as part of your evaluation. Well, for me, it was an easy critique and an easy criticism. And so I shared that with the group, and it says, oh, and I wrote a short letter that said that. And they said, okay, you need to go to the health department, you need to go to our city council, you need to do it. And I said, no, I do not. I said, you guys need to go to all those places you just mentioned. I will help you. I will work with you. I will, counsel you. I will talk to the media about this, but you guys are the ones who need to take this information and understand it well enough to talk to these politicians and these decision makers. And they, of course, at first were just like, oh, no, we can't do that. But we had an organizer who sat with them and said, yes, you can. Yes, you can. And what do you have to know anyway? What are the message that comes out of this that you really need to understand? You've got Steve's letter. And so that was a huge turnaround for this group because they did that. And what it did is it gave them credibility. It gave them confidence. It gave them an enormous step forward as an organization. Whereas if I had been the one doing that, they would have gotten nothing. I would have come and gone, and they still wouldn't have had the kind of power they do today as a group. In fact, the man who led the group then is now on the city council. They ran him for office and he won. And so now they have somebody on the inside making decisions about the cleanup, because they're still doing more testing. They're still haven't quite resolved the situation, but for them, it was a huge. All right, now what do we do? Not moving at all now. Let's try this one. Sorry. Here. Okay, great. All right, so that's Wausau. This is Birmingham, Alabama, where they have several coke plants. It's an African-American community. And the coke plants release many different kinds of heavy metals: arsenic, lead, cadmium, chromium, you name it, mercury. And it's just filtered throughout the entire neighborhood. EPA of the state came in, did some air testing and some soil testing, and they found enormously high levels. And they invited an agency called the Agency for Toxic Substances and Disease Registry, ATSDR, which is responsible for evaluating health risks in the public. And they found that the levels of arsenic, this is a waste pile in the neighborhood that from the processing. And this just blows into the neighborhood right across the street. And so it's just a crazy situation. But ATSDR said, yes, the levels of lead and arsenic are well too high. They're above any kind of public health standards for these chemicals. And what should happen, their recommendations were that the families, the moms and the dads should not let their kids play in their yards. They should have them take their shoes off before they come in the house. They should wash their hands after they do. And they gave them some fact sheets on the toxicity of lead and arsenic. And it was like, you know, they were stunned by this. And I was stunned. We, CHEJ, was stunned. I mean, how do you have these high levels of these metals in this neighborhood? And what people should do, people who live there, not the agencies, not any of the governments responsible, not the companies who are responsible for pollution, they don't have to do anything. But EPA, I mean, the people, they should watch where their kids go and where they play. That's a smart thing to do. I mean, so what in this situation, we've worked with this community quite a bit. It turns out that the local representative, the regional EPA director, and the regional head of the DEP in Alabama all have recently been indicted because they were all taking money from the companies to do nothing. And so this place has turned into a crazy situation, but they are trying to get relocated. That's their goal. Okay. Little technical difficulties here. We only have a couple more to go and then we're done. All right, let me see. We can go right past this. What am I hitting?
Yeah. Are you?
Yeah, I'm done.
You're done? Yeah, I can change this
All
slide.
right, move on. And then we have this group in Texas called THEA, Texas Health and Environmental Alliance. They're dealing with a paper mill waste product, landfill that was built along the San Jacinto River, which is a tidal river that goes into Houston, Galveston Bay and the Gulf. And they're again dealing with dioxin contamination because of paper mill, International Paper and Waste Management, the landfill operators and owners. And they've been struggling. They've done a great job. They also did something pretty unique in that at the time, what was the guy's name? The head of the EPA at the time, Scott Pruitt, went to visit the site. And there's only one road that goes in and out of this landfill area. She blocked the road that goes into this landfill and stopped Scott Pruitt's caravan and said, you have to listen to us. You're having this event, you're coming here and there's all kinds of media event around it, but you're not talking to us. So she forced him to have a conversation. And she got a call from the media at 2 a.m. that said, did you know Scott Pruitt's coming to town tomorrow? And she said, no. So she called us at 2 a.m. and said, can you help me figure out this plan? What do I got to do? What's the best thing? And we didn't have to say very much to her. She already knew what she had to do, which was to be there and block the road. And she did, and she got Scott Pruitt to listen. And he was, of course, taken by what she had to say, not to mention her tactics and her emotional place. Yeah, if you would. Okay. It's a picture of Jackie, and that's the Superfund site notice. And so the EPA in this case did the same thing. They decided to clean up this landfill, spend $193 million to remove the waste from the landfill along the river. And they're in the middle of that cleanup now. And so they've made, it's these little things that make such a big difference. briefly, I'll talk about Flint and maybe we're running out of time. How much more should I go? Okay, all right. So Flint, you all know the story of Flint, I'm sure. And we worked with that group very early on. They sent us some of the data. We saw a little bit of the high levels of lead and a little bit of the these things called trihalomethanes, which are also in the water, which nobody ever talks about, and said these are way above government levels. But we realized quickly, because of the way the whole Flint thing happened, was that, again, it was very politically insulated, and they weren't going to win by keeping the problem in Flint. They had to go outside of Flint and bring in Detroit, bring in other areas outside. And that's media attention, and that's organization who bring credibility. And part of that process involved a professor from Virginia Tech who ended up going in and doing some testing for them, and a pediatrician who also did blood testing, and they ended up being very successful. And it became a national cry. I mean, around the country and it was a symbol of the lack of government protection of people and the failure of science to protect people. All right, I don't know if I have time to do this. I'd like to talk just briefly about this one last situation. It's a Native American group I'm working with, the Yankton Sioux. They're based in South Dakota, and they have a vision. And this, what's interesting about this is the people that are involved in this, the organizations, which includes Tufts University. Tufts has Kyle Moynihan from the data center has involved a number of the students here in this project, and we were mining some. The project is in an effort to, let me take a step back. The project is in an effort to co-manage the Missouri River, the portion of the Missouri River that runs along the reservation. And this is a government to government kind of thing. The native tribe, the government, right? The US government manages the Missouri River according to its own needs and its own influences. They want to sit at the table and be equal partners with the US government and how that's managed, because all their needs and interests, whether it's cultural, whether it's medical, whether it's spiritual, are being completely ignored. And so they want to, that's their goal, is to co-manage it. And a big piece of that is evaluating the water quality. And so that's where Tufts got involved, is they helped evaluate some of that data. And we're in the middle now of training local native people to do their own water testing. And I've been still involved in helping them interpret those results and helping train people to do that testing themselves. And it's been a remarkable project. And one of the students here took a year off from Tufts during COVID and worked with us, and he had a big role in working on that project. I don't see him here. I think I'll see him later perhaps, but he was a big part of that project. So that's pretty much it. So I would like to leave a little time for Q&A, but that's what I have.
Thank you so much, Steve. We do have time for questions, so I can pass the mic to the audience, or I can carry it back to Dr. Gomez, who would ask questions from members of the audience who have put it into the Q&A. I can kick off a question. One of the things I notice is it almost always seems like the problem starts getting solved when it gets out of the local community. Not all, maybe one message might have been the federal government ultimately ends up paying for these things, but I'm not sure, does it always have to involve the federal government? How do you have stories where it's just a matter of getting the state to engage, or the city to engage in a neighborhood issue?
Well, with the Warsaw situation is a little like that, because the city is the one involved in making this decision to do more testing. And so, but the city doesn't have the resources to do the testing, number one, or to interpret them. So that's where they brought in the state health department. And so the health department kind of, once they realized that they had made the mistake of doing an analysis without looking at cancer risk, they kind of had their tail between their legs. So they've been more than happy to be cooperative because of that situation. But most of the times these situations involved a lot of money for cleanup. And that's what most people want, cleanup or relocation. And so local agencies, government doesn't have the resources to do that. So it does involve looking at big picture situations.
Thank you, Steve. This was really sad, but at the same time, hopeful to see the power of communities. So all these were successful cases where the communities could get things done, but there are so many other times where this doesn't happen. So in your experience, what is the tipping point for a problem like this to move to the next level and to get the attention? Because I know even in cases where the news are involved, it's not always the solution, right? So in your opinion, what is the tipping point for a problem to start getting solved?
There's at least several important ingredients. One is the group has to know what it wants. That's the hardest thing we go through with people from an organizing context. What do you want? What do you as a community really want from this? Do you want relocation? Do you want to shut the plant down? Do you want cleanup? It's not, you'd think that would be obvious, and sometimes it is, but most of the times it's not. And the group has to be together on that, because there are often opportunities when the media comes in, or there's somebody from Washington comes in, or some politician comes. And when those opportunities come, the group has to be ready. The group has to be prepared to say, okay, this is what we want. Because if these people come and go, then that opportunity is lost. And so that's the thing we tell people, that you have to think about what you want. You have to be prepared, and you have to be willing to say it to these people when they come, because they often do. There's usually media attention that generates from all of these things, and it escalates. The longer these things fester, usually the more things escalate, the more attention that they get, and the group has to be prepared to take advantage of those opportunities when they come. I don't know if there's a tipping point you can control, but I think there are times you have to take advantage of opportunities.
Hi, my name's, whoa, that's really loud. Hi, I'm Jess. Thank you for your talk today. It's been, I remember when you spoke a couple of years ago, and it's just remarkable work that you guys do. So thank you. I'd be interested in hearing a little bit more about what's involved in cleaning up some of these sites once that's achieved. Like, how long does that take? Where do those chemicals go? What's sort of a safe removal process?
Right. It depends a little bit on whether it's a part of the Superfund program, which is the federal cleanup program for the worst contaminated sites. So they have a very specific set of procedures and policies and roles for the public to play in that process. It's a multi-year process almost always. The minimum, I would say, is 2 or 3 years for a small site. And they're sites that people have been working on for 10 years. They break them into what they refer to as operable units, or they'll take on the groundwater, or they'll take on the surface soil and clean up that, get that done under control, and they'll move on to the next operable unit, and so on. And so, like, these decisions literally take anywhere from typically between 4 and 8 or 10 years. It's a long time. And the fight over what gets cleaned up and to what level is an ongoing fight. Even in the case of like the Texas Houston site, they had an agreement, what EPA calls its record of decision, that every site, the entire site would be cleaned up to a certain level of dioxin. Well, 2 years later, the company comes in and says, well, we think we can achieve the same goal of cleanup by going to higher levels in different places. And so they're constantly negotiating. And so the group has to stay vigilant and stay involved and continue to fight those kind of changes, because the companies will continue to try to save $1 where they can. And it's not just $1. These things cost millions. And if they can save a few million, they'll try to do it.
I have a few questions from the online audience. The first one from Michael Kenny. What progress have you seen in holding companies accountable for their role in creating these issues?
Could you say it again, Sarah?
what progress have you seen in holding companies accountable for their role in creating these kind of issues?
Not very much, honestly. The companies have been largely insulated from many of these situations. They are not often held accountable. And it's because the government is willing to work with these companies. They don't want to fight them. They don't want to take them on. Through the Superfund program, the law provides the US government with the ability to recover what they refer to as triple damages. So if the government spends $100 or $100 million to clean up a site, they can collect 3 times that cost from the companies. But they have to go through lawsuits. They have to get lawyers involved. It can take years and years, and the companies are very good at taking years and years. So they end up working with the companies to try to come up with some compromise, some resolution, which of course is an agreement between the company and the government. The community is not a party to that. And so they're often left out in the cold, which of course creates anger and frustration in communities. So the one difference that has happened is that when Trump's EPA was involved, they made decisions without any concern for the companies. They just said, this is the cleanup we're going through, and that's the end of the conversation. And those 2 examples that I mentioned in St. Louis and in Houston, it's close to $500 million between the 2 of them. And there's no negotiations. The companies were not involved. They were angry. They tried to fight back, but EPA said, no, this is what we're doing. And so that's pretty unusual. That has not happened historically in government, either Republican or Democratic EPAs in the past. But that was one good thing that happened to some communities during the prior 4 years.
Thank you. I'm going to combine a couple of questions from Elisa Guzman and Krishna Kumar. They're wondering about preventative measures. So all the cases that you have described are talking about after the fact when the problem is already there. But they're wondering, A, what are the impediments for prevention? Are they because of local and state control and regulations? Is this a legal issue, resource issue, or a political issue? And then they also ask whether your role as your organization is only after the fact, or do you also work with communities to prevent problems?
Well, it's a good question. Most of these sites that we work with are communities that have been contaminated from dumping and activities for years gone by. A lot of these, going back to the Love Canal, was the 50s and 60s and 70s, and those legacy sites exist all over this country. There are 1,500 federal Superfund sites, all contaminated all over the country, and there was another 25,000 that are contaminated industrial sites and other landfill sites that are not as bad as the Superfund site. So and those are the communities we work with, the people that live in these places, because they're trying to get cleanup and trying to get attention to these situations. So what we did for a short while as an organization is we talked to people about, okay, because a lot of people will come to us when they're fighting a proposed landfill or a proposed incinerator or a proposed industrial process and site. And we say to them, well, okay, let's sit down and have a conversation about, okay, if not the landfill, then what? What do you as a community want for economic development if it isn't this plant? Because this plant's going to bring revenue to your company and to your city or town or area. That's one of the reasons why it's attractive to the decision makers. What's the alternative? And you can decide this, you as a community. I mean, we did this in North Carolina where we asked them the question, all right, it was an industrial plant that wanted to move in, and we said, okay, what are the resources in this community? And it happened to be near Mount Olive, the pickle place. They make Mount Olive pickles. And they said, we can't get a local pickle here because it all goes everywhere around the country. But they ended up talking to the fact that local vegetables is something they don't have. So they ended up creating a farmer's market and they were able to get their politicians behind that instead of building a facility in their neighborhood. And that generated some revenue, and the people felt good about it, and it was something they needed and wanted. But there's not enough of those conversations that happen in communities where people say, okay, how do you want to control what goes on in your community? How do you want to have influence on what goes on in your community? Most of the public doesn't have that opportunity to have that kind of input. They're not being asked. So the developers and the decision makers don't go to the local people who live in the neighborhood and say, what do you want here? So, I mean, there's opportunities for that to happen, but it's pretty rare and far between.
If there are no questions from the in-person audience, I'm going to keep asking from the online questions. Emily White asked, how do you get connected with these community groups and choose what projects you work on?
We don't get connected to them unless they contact us. They find us. They mostly know about the Love Canal story, and Lois Gibbs, her name, is the calling card, if you will, to our work. So people will go online now. They used to call us. I mean, I can't tell you, in the archives, we have letters, hundreds of letters we used to get every week from people all over the country. Now it's all by email. We rarely get even a phone call anymore. But they find us and they contact us, and we work with them that way. And we do have to make decisions because we have a pretty small staff, especially today versus years ago. At one time we had a staff of 17 organizers. Now we just have 2. And so it's quite a difference. And so, so we do have to be more judicious and thoughtful about groups we spend our time with. But after all these years, we kind of had figured out a way to make those decisions. And the key question we ask them is, okay, are you going to make a plan? That's where we go with them is okay, you need some help. Here's some science help. Here's some organizing help. We can help you just go to get structured. But the next line of questions is about, okay, what's your plan? What are your goals? And do you have a plan to get to your goals? And so that's that process. And if groups don't want to do that, then we can't really work with them. And those that do are the ones that are successful. The ones that develop a plan and come up with a strategy to achieve that is the ones that, and people have to realize that you do have to do that. It's not just going back to what I said very early on. It's not just get that right information in the hands of these people, the decision makers. These decision makers are faced with corporations and all kinds of financial issues and legal questions and all kinds of things are pulling them in all kinds of directions. And if you don't have anything more than, some piece of information that their scientist says, well, we disagree with that, then they're not going to do what you want. You have to recognize the political context of all of these situations and influence on decision makers. And they're going to do what makes the most sense to them. And so you have to get in their face.
I have maybe one final question from Anne Foley. It seems as though W.R. Grace won in the Woburn case. Was that area ever cleaned up?
What was the last part?
Was the Woburn area with all the Superfunds that are there, was that area ever cleaned up after W.R. Grace won?
Yeah, Lois met the women, Ann Anderson and the other ladies who were organized in Woburn. We were here then, back in the late 80s. And even before we had our organization, they contacted Lois at Love Canal and said, can you help us? And she did, and we did as individuals before we were an organization, and then afterwards. But they, it's a sad story in some ways what happened there, because the lawyer got a lot of credit for what he did, and he couldn't have done anything without the community on the ground doing what they did. Anne and others did, and the Reverend that was involved there, I forget his name, Reverend White, I think it was, Bruce White. But anyway, they left the area, and a lot of those folks, they got supposedly the site cleaned up. I don't know, I've kind of lost touch with whether it's really been cleaned up and to what extent it's been cleaned up, but they did have a plan for cleaning it up.
I want to thank you so much for a great talk. If everybody could join me.
I'd just like to make one pitch for interns. We have a pretty good intern program. Tufts has been a steady stream of students for us, and we welcome them. On our website, we have a whole section on interns. So if anybody's interested, we'd love to talk with you about it and hear from you. Yeah.
In that situation.
Well, Lois was arrested several times.
Yeah, the question was, if interns end up working with this great organization, might they see some jail time as a reward? And so I was asking if anyone has had that situation occur.
And the short answer is no, they would not face potential jail time. We're very careful about that. Yes, yes. But Lois was arrested during the Love Canal fight. They were blocking trucks that were going in and out to the cleanup site. So they were out there in November or December, it was freezing cold, and they blocked trucks. So it happens. But we're not on the front lines in the same way that we were during Love Canal or that people are. Because we believe very strongly that we don't speak for people and that people have to do for themselves what they can do. And so they're the ones who have to be out there doing. That's why I wouldn't speak for that group in Wisconsin. They're the ones who are, and that's how you learn. That's how people learn, by being forced to do things that are outside their comfort zone. And so, and those are the groups we work with, the ones that are willing to take this on themselves, because that's how you win.
Stephen, thank you again for giving the Jonathan Kenny Memorial Lecture. I can see why he has been inspired by your organization and your work, and repeatedly invited you back to talk. And so you've done a great honor in his name. Thank you. I also want to thank you all for coming, and those of you in the audience, thank you so much. We'll close this lecture now. I'm sure he could stick by and answer some questions from those of you here if you have any questions that you want to follow up. But again, thank you. And thank you again, John, for your music